The biggest myth is that you need fluoride to keep from getting cavities. Even though people will say that it is natural, which is true, fluoride is naturally occurring, but the form that we have put in our water supply is definitely not natural. And fluoride is not an essential nutrient. It's not an essential nutrient. I have an entire practice full of patients who have healthy teeth without fluoride. It's an ingredient that we use as a tool that can prevent cavities, but we have other tools that have a better risk profile than we now know that fluoride has. And so I would much prefer using other tools besides fluoride.
All right, it's a real pleasure to have Dr. Toni Engram on the show today. Welcome.
Thank you so much for having me. I'm excited to be here.
When we first met, we were chatting away. I think we had a whole hour or so because I took so much of your time. I was like, what about this? What about this? And I probably should have hit record back then and we would have been done with it. But I have a list of questions to ask you. And you're a perfect person to ask because you're a biological dentist. You're helping people rethink how oral health impacts the whole body. And we never think about it. We always think, well, there's your mouth and then there's the rest of the body, and they're not connected, but they are. So for those of you who've never heard of it, what can you explain what is biological dentistry?
So biological dentistry, it's like we're gonna go high level and then I'll kind of get down into the nitty gritty. So high level, it's based on the principles of biological medicine. And in biological medicine, we go beyond the germ theory of disease. And the germ theory just says that one germ causes one illness. And we're looking at more of the terrain theory of disease. And in terrain theory, we're looking at the health of the entire body. And what are we doing to support health? Or what does the terrain look like that's causing disease? And so in dentistry, that means what are we doing in the mouth that supports your overall health? Or what maybe is going on in your mouth that's contributing to you being sick in other areas? So we're kind of like the functional medicine, naturopathic versions of your friendly neighborhood dentist. And in practice, that means most of us aren't using fluoride. We're really, really careful with those old mercury fillings that we all got when we were kids because they are half mercury. So we're very careful with any kind of toxin. And we're really looking for these hidden signs of infection because we know that it impacts your overall health and not just the health of your mouth.
Yeah, this is such a new concept, I think, for most people. And I guess even doctors. I mean, I don't know. I mean, doctors, dentists, regular dentists, like they call
Yeah,
normal
yeah.
dentists, non-biological dentists. And you often talk about the oral microbiome, but most people also don't even realize that we have a microbiome in our mouth. So let's start there with the oral microbiome. And we have eye microbiome and gut microbiome, and we have so many microbiomes. And I think when the first time you hear like, oh, there's more than one, it becomes super interesting. So why
Right.
is the oral microbiome so important for our overall health, and what is it?
Oh, just like you said, we've got more bacteria in us than actual human cells. And each environment is a different breeding ground for different types of bacteria. And your mouth is just one of those. So you can have a microbiome that is super healthy and well balanced. And when that happens, it's not too acidic, the pH is fairly neutral. The bacteria, they coexist really well with the host. So they're friendly to us. They support our health. They actually will help even the beginning of the digestive process. They'll help start to break down the food that we eat as we chew. And it's also self-limiting. So when you've got a healthy microbiome, it doesn't want to take over the mouth. It doesn't want to create thick layers of plaque and tartar. It's really self-limiting. And it kind of has this team approach to repelling any pathogens that come your way. So it really is just this beautiful ecosystem when things are in balance. When they're not in balance, though, then things can kind of go awry. So there are pathogens that, when they take hold, promote inflammation instead of feeding off of proteins and the enzymes in our saliva. They actually feed off of carbohydrates like sugar or just any kind of crackers, goldfish, those kind of carbohydrates. And some of them actually feed off of our blood and dying tissue in our gums. So that's when things get really not so friendly. They like more of an acidic environment sometimes. They don't like to keep the pH neutral. So the acid balance kind of gets out of whack, or it will promote overgrowth in certain areas. That's why some people get just this overgrowth of plaque and tartar buildup, and it's this continuous cycle. So your microbiome is just incredibly important and complex. And I think the complexity is so beautiful because we're just at the tipping point of what we really understand about it. They've observed over 700 different species of bacteria in our mouth. And so we're just really at the tipping point of understanding what all of that means.
So it sounds a little similar to the gut microbiome, where there's these good guys and bad guys, and the good ones we want a little bit more of, or them to be in balance. Because I guess if you wiped out all the bad guys, maybe you need some of them for some reason. I don't know. But you don't want that imbalance, because then that's what's causing the plaque and the tartar. And then what about bad breath? Does it also cause that? Because I understand bad breath can also be a sign or symptom of something going on in the gut or in the kidneys, or that's what I think you
Yes.
study, right?
It really can be a combination of both. So you're right. It can't come from the digestive system. It can come from the tonsils, from the airway, the back of the throat. So if you've got an inflamed throat or you've got sinus issues, sinus drainage, then that can create bad breath. There are specific bacteria in the mouth that create sulfur compounds. So it's those sulfur producing bacteria that can often be the source of bad breath.
Interesting. Okay. So then what would the solution be? Just to, because most people just pop a mint and you're done. But if it's something growing in your mouth or in your lower gut, then how does just popping the mint is not going to really solve the problem.
Popping a mint doesn't solve the problem. So if we can get to whatever that root cause is, that's the ideal, is you got to get to the root and solve that. So if it's an airway issue, if it's a sinus issue, figuring out how we solve that. If it's a digestive issue, then figuring out how we get the gut to heal. If it really is just isolated to the mouth itself, then there are dental things that we're doing. So do we need to treat some early gum disease? Do we need to remove the plaque? And that's where I really like to test my patient's saliva to see exactly which species, which compounds are in there, because then we can be really strategic with what we do to fix it. There are some bacteria that respond really well to just getting caught up with your dental cleaning, kind of give us a fresh start and start over. And sometimes that solves it. But there are some species of bacteria that are pretty resistant and pretty hard to kill. And and not only that, but they're often associated with other health issues. There are some strains of bacteria that are associated with poor fertility issues, with autoimmune conditions, with different cancers, with anything anti-inflammatory. And so we want to take a more aggressive approach to those. And so sometimes we'll put patients on a protocol where we sort of need to kill as much as we can first. And so we'll do an antimicrobial rinse of some kind for a limited period of time, usually just a couple of weeks. And then we're reseeding the mouth with the probiotics that we want to see. And then sometimes we can take a much gentler approach. And sometimes we're just using things that are much easier, just xylitol products, again, a good probiotic. And sometimes that gets us the balance that we need. But I like to be strategic there because the solution isn't the same for everybody.
Yeah, it sounds pretty complex in the sense that also when you have a gut issue, people take a gut microbiome test and you have to poo in a paper tray, right? But here, this is, it's a
Mhm.
little bit easier. You just take out some saliva and then you can maybe take more of a targeted approach rather than just trying a bunch of things and seeing what will happen. So it's very similar to gut microbiome, how you would attack a problem or an issue. And I bet they're also super connected. But one of my next questions was about how the oral microbiome or just how oral health in general can affect your brain or your heart. And it reminds me of a woman. I literally just met her in the gym, and she says her husband started having a toothache, like really horrible, didn't resolve it. And now he's in the hospital with a brain, I don't know, tumor and all these pain. And I was wondering, I was like, gosh, I wonder, when she said that, I was like, I wonder if this is sort of that connection that we tend to ignore. She's not making the connection with the tooth. And I've heard of some regenerative medicine doctors as well saying, well, we like to see thermograms and see the mouth because there's inflammation, because you can see a direct line going to the breast. So they're worried about breast cancer or something. And
Yeah.
it's an incredible world. So how are you able to make these connections? First of all, how does our oral health affect the rest of the body?
There are lots of different ways. So, really, it starts back in Eastern medicine. So, in Eastern medicine, and this is a concept that's been around for thousands of years, each tooth in the mouth is connected energetically to different organs and systems within the body. So, Eastern medicine has had this right for a really long time. In Western medicine, we're starting to catch up because now there's more and more research that supports this. There are more and more peer-reviewed studies that are showing those correlations between oral health issues and, like you were saying, cancers, heart disease, and some of the really scary stuff. The mechanism so far we think is in the bloodstream itself for the most part, because inflammation in the mouth, the tissue in your mouth is just very absorbent. So the oral mucosa, all the pink stuff in your mouth, that has such a close connection to your circulatory system that you absolutely will get some of those bacteria that get into your bloodstream right away. And it's happening all day, every day. And so those specific strains of bacteria, the ones that are more implicated in health issues, they really are causing that inflammatory response, not just in the gums, but in the coronary arteries and in other parts of the body. So we think that the mechanism is around inflammation, and it's based on these certain bacterial strains that are causing the inflammation in different ways. And then again, like in the case that you were mentioning, it what sounds like a tooth infection, and we know that a tooth infection, that infection is not just staying isolated to the jawbone. That infection is systemic, and your body is having to work on that to fight it. Now, maybe in this case, if there was also something found, like a brain tumor or something like that, then it could have been causing some referred pain, and the tooth is just where that was showing up. Or it
Actually,
could have
it was a
been.
nerve. Actually, if I recall now, she said it was like a nerve pressing in his brain, and he asked to get
Gosh,
an operation, a brain surgery.
wow.
But yeah, it is crazy. And the mouth is so close to the brain. I can almost see the connection sooner with that than your mouth and your big toe. But I mean, that Eastern medicine always blows my mind and says I'm wrong. But it sounds like what you're saying is that it's because there's so much in our mouth, there's so much access or speedy access to the bloodstream, then that's how it can get down to your big toe because you have this blood highway.
Mhm.
And that kind of also reminds me why some people take testosterone in troches or medicine in troches. I just this morning took methylene blue in a troche and I had to stick it in between my tooth and my gum and let it dissolve there. Lots of sublingual peptides. Like it makes sense to me.
Yes. It's the best place to absorb medication other than a suppository.
Yeah, incredible. Yeah. It's just we have these orifices in our body that are
More pleasant in the mouth than as a suppository most of the time.
yeah, usually. And a lot of women now are taking their oral progesterone and sticking it up vaginally because they feel too groggy
Mhm.
or they're getting too many negative effects with it. And that way can bypass the liver.
Yeah. Yeah. Isn't that fascinating?
Yeah, crazy. Then let's since we're talking about menopause as well. How as we're losing our estrogen and our testosterone, progesterone going through this transition, does it affect our oral health or maybe our teeth or jaws or gums? Because I know as a gerontologist, as we're aging, we do lose bone in our jaws and there's lots of things that happen. So what specifically do you think is related to menopause?
Fortunately, all of the above, all the above. So you're right. When it comes to bone health, yes, if you're prone to osteoporosis, osteopenia, if you're losing bone, you're going to probably be losing it everywhere. And that includes the jaws that support the teeth in place. And so we want to make sure that taking care of our bones, that includes taking care of the bones of our jaw. And so that's a huge one. But the hormones themselves, you're right, that loss of progesterone and estrogen can really impact the saliva. It'll cause you to have less saliva and less of those protective effects from the hormones themselves. And so you'll see more, I mean, all of your wet parts dry out. So it's your eyes, it's your vagina, and it's also your mouth. And so you will get the more often dry mouth. If you had an inkling of a sleep disorder, sleep disordered breathing of any kind, sometimes it really makes itself known during this phase too, because now all of a sudden you're not only were you not sleeping great to begin with, but now your hormones are kind of wacky. And so that dip in progesterone makes you sleep worse. And then maybe you sleep with your mouth open and that dries you out even more. And we'll start to see new cavities or new gum inflammation pop up that already kind of had the foundation, like the underlying stuff there. Maybe the microbiome was out of balance already. And then the drop in the hormones really causes it to become now much more noticeable, becomes a clinical issue, a dental clinical issue that we need to solve then. So huge impacts that we see every day. So yes, if you have more cavities all of a sudden or gum disease pop up where you never had it before, then it can absolutely be those hormone levels changing.
Do you see any patients who have some of these uncommon menopause symptoms like burning mouth or metallic taste? They're
Yeah, we see both. We see both. Less the burning mouth, but I'll say probably, I don't know that it's once a month. I mean, thankfully, I don't see it every day, but maybe every couple of months we'll have somebody with that strange metallic taste. And so then we're looking at all of the options. Is it some dental work that needs to be replaced? Do we have something going on that's a dental issue? And if not, then we're absolutely working with our functional medicine partners, our naturopathic partners, and making sure that the patient's getting the support that they need elsewhere.
Hmm. Yeah, because a lot of these symptoms are due to a loss of estrogen. So then I'm wondering, in your patients, the ones that have explored that, do they find that adding in some estradiol and progesterone helps with their burning mouth or metallic things, metallic taste?
I've had a few that do notice that it helps, yes.
Yeah,
But
interesting.
I mean, it's one of those that they really have to be, it takes some Sherlock Holmes kind of medicine, really, because sometimes those are the patients where there's also some other underlying stuff, like maybe autoimmune conditions. I've seen a lot of Lyme pop up in the last few years too. So it's really digging in and seeing what's the root cause of root causes, or what's a root cause that will give us the most bang for our buck when we treat it. Because sometimes it is the estrogen and sometimes it's things that like we can't even get to the estrogen yet because we've got to solve some of these other issues first.
Yeah, I think it's so easy to blame menopause and hormones, and it's very often the first thing I think of with almost any complaint. It's because it's what I know, and you think maybe it is or maybe it isn't. But I think what we tend to forget sometimes is that if you come into menopause or you're going through this transition already with some baggage, and it's kind of like what you said, there was maybe some starting of poor breathing habits or poor sleep, then when you get into this transition and then you lose the estrogen, progesterone, testosterone, then it's accelerated and then becomes prevalent. Maybe you didn't notice it so much. And now you're like, it's menopause and hormones. And in a way it does. But at the same time, if you bring all this stuff in, then it's could be that as well, or somehow working with both, attacking things at both ends. And I often like to ask women to just take a look at your hormones or ask your doctor to explore this and try to dig things up. And if it is hormones and if you are interested in trying them, and because you can always try and then if it doesn't work, then you can always stop. But if your hormones are off balance, whether it's through, you can balance them through supplements and diet and lifestyle or with hormones, just getting them in balance. If that's not the root cause, at least it will support your efforts of finding the root cause. And I think in a way it just helps the whole thing in the end.
Yeah, that makes total sense. It gives you enough support to kind of get you in a spot where you've got the bandwidth to find the other things. And I wonder too, and you tell me if you agree or if you think I'm off base, I wonder if this is just part of the beautiful design. Because what I noticed when I was pregnant was that my hormones were at such a level that I had very little patience. And so the niceties that I normally exhibited just kind of went away. And I was much more direct and I said what I needed to say. But that was pregnancy. And I'm noticing like a similar effect as I'm having some of these like really interesting symptoms of perimenopause the last few years. And so I wonder if that's the intention of this season of life, is that the drop in the hormone really just allows us to be more of ourselves and say what we need to say and be able to express what we need in ways that we weren't able to when we were younger. And that perhaps that's overall just a really good thing for us.
Yeah, that's the benefit of menopause that nobody talks about.
Yeah.
And we just don't take any BS anymore. And that could be a good thing. And sometimes you overshoot, okay? But we're
Right.
trying to find balance here. And I think there was this comedian. It was so funny the way I will never be able to repeat like she does. And if I could remember her name, it would be even better. But she was just explaining how we lose our hormones. And before somebody rammed their shopping cart into our foot, we'd be like, "Oh, I'm so sorry. I didn't mean to get in your way." And then when we lose our estrogen, I think she was talking a lot about estrogen, I think. And yeah, we just don't have the patience anymore. And that's it. And she goes, "You know what? We just turn into a man. We just become men." Just so funny. And I just thought, well, yeah, that's the power. We can look at it that way. But I think part of it maybe is menopause, but part of it is the loss of the hormones. And part of it is just aging. Have this experience in life because it happens to men too, in the sense that you get closer to death and you realize I have not so much time on this planet. And there's this, what was it called? Social selectivity theory in gerontology. We decide we're not going to spend time with people who drain us and make us feel bad. We spend time with people who support us and make us happy because we are closer to death. So
Yeah.
kind of universal there.
Oh, I love that. Love that. Okay. I'm going to start practicing social selectivity.
Social selectivity theory, socio-selectivity theory. It's just great. I want to get into some of the nitty-gritty stuff of what people are seeing in their mouths as we're aging. I don't think this one has anything to do with menopause, but gum recession. It's common in midlife and perhaps wear and tear, but I've even seen my daughter who's in her 20s like showing me because of the way she's brushing. But is this aging? Is it just the brushing? Can we do anything to reverse it or slow it down?
And there are several things that can cause it or contribute to it. So it just depends. In your example, yes, young people that are just simply brushing too hard, then too much abrasion on the gum tissue can cause some recession there. Oftentimes, it's actually grinding or clenching, and that imbalanced pressure on certain teeth in certain spots, that can cause the teeth sort of flex within the bone. And at that flexion point, at the gum line, you've got enough flexion and you'll start to lose some of that gum and bone support underneath, We talked earlier about osteoporosis and losing bone. Well, when you lose bone in the jaw, the gum tissue is going to follow. And then gum disease is always just a huge cause of loss of bone and therefore loss of gum tissue, because the gum tissue is not going to be there unsupported without the bone. So you lose bone and you lose gums. That's just how it happens. And so sometimes in midlife, you get to a point where you've got maybe more than one of these factors at play. If you grind your teeth and you've got a little bit of gum disease and you're brushing too hard, then you're going to see that accelerate. And so sometimes that will pop up in midlife, and we've got to start playing a little bit of whack-a-mole. Okay, what's the cause, or what are the causes, and what can we do about it?
Interesting. So the way we brush, maybe too much clenching and too much stress, losing the bone, like we can't, I don't know if we can, yeah, we can actually, well, maybe hormones if help us lose but less bone. And then you have the gum disease, but the gum disease almost sounds like it's coming because of some of these things. But is that have to do with the microbiome in there and like the more bacteria and adding to, and gum disease, like gum disease, actually, maybe you should define gum disease because it's probably an umbrella term, no?
It is. Yeah, you're absolutely right. Gum disease is the lay term for periodontal disease. And the periodontium is just the system of ligaments and soft and hard tissue that surround each tooth. So periodontal disease is an inflammatory process caused typically by a dysbiosis in the oral microbiome. And that inflammatory process eats away at the gum tissue, the ligaments that hold the gums to the roots of the teeth. And that inflammation actually does degrade the bone itself. And so you'll get loss of both over time if gum disease has a chance to really progress. And we can start to see some of that early, because sometimes you'll get a puffiness, the inflammation, you'll get a puffiness in the gum tissue first. And so when you go to the dentist and they use their little ruler, patients tell us it feels like a pokey thing, but it's just a teeny tiny little ruler. And the hygienist is calling out numbers like 3s and 2s. The reason we're doing that is we want to see how puffy is the gum tissue compared to the bone. And so we're placing our ruler in between the little turtleneck of gum tissue around your teeth and seeing how far the ruler goes. So nice, tight gum tissue, you're going to have very small measurements, like 1 to 3 millimeters. When we start to see inflammation, then the puffy gum tissue you'll have more space between the top of the gum tissue and where it's attached to the tooth. And so you'll start to see 4 and 5 millimeter distances that we're able to place that ruler in. And then when it progresses even more and we've actually lost bone, but maybe the gum tissue is still there, but so the pink gums are there, or usually by this point, they're not so pink, they're kind of reddish, but the bone has started to degrade. Then we'll get those 5, 6, 7 millimeter pockets in between the gums and the teeth. And that's when we've got some serious issues, like some serious gum disease that we really need to treat before we start losing teeth.
How do you treat it?
I look at the microbiome first. We want to see which bacteria are causing it. We want to see what all the causes are. A lot of times we're doing a cleaning that will get the plaque and tartar buildup from below the gum line. So in just your normal dental cleaning, we're staying right around the gum tissue is nice and tight around the teeth. So the hygienist doesn't have to go very far under the gum line to be able to get all the plaque and tartar off. But in these 5 and 6 millimeter pockets, obviously the hygienist is going to have to go below the gum line, because the tartar buildup sometimes is what's keeping the gums from reattaching. So we've got to remove that tartar buildup. And it's by this point, it's not something that you can remove with a toothbrush or floss or even a water pick. It really needs to be an instrument that typically you're only going to find in a dental office to remove that hard buildup that's on the teeth so that the gum tissue has a chance to reattach to the tooth the way that it should.
Is that painful?
It
Yes.
depends.
Just say yes.
Where the goal is for it not to be.
Yeah.
So I have lots and lots of patients who tell me horror stories about having a deep cleaning, or scaling and root planing is what we call it, and having significant pain during or after. And so I work very hard to make sure that the process is not painful. We're using, if it's to this point, then we're using numbing gels and creams and sometimes local anesthetic to make sure that it's comfortable. And then we treat it just like a minor surgical procedure. We're going to give you post-op instructions on how to make sure that you have little to no pain after the procedure too. So it takes extra support at that point, but that's extra support that's very doable that we can do.
So I know what receding gums feel like because I have them. And I know that your teeth become sensitive. And so then we had, at least this is so long ago, this is maybe 20 years ago, I had a dentist put on some kind of a layer and they're not sensitive anymore. And if they did start, then we have different types of toothpaste. So what are the other problems that can happen when somebody has receding gums?
I think the sensitivity is one of the most common ones because the tooth the root of the tooth loses its blanket and it's used to having a little blanket over it. And so it takes sometimes a little bit of extra time and effort to make that tooth not sensitive anymore. Sometimes you can even replace the gum tissue. There are grafting procedures where you can get that gum tissue back to cover it up, just depending on where it is, how severe it is. Other issues that pop up from gum recession, it is really just losing the support around the teeth over time. Your gums are meant to be up around the neck of the teeth. We're not meant to see a ton of root structure on the teeth. And so it creates more nooks and crannies that people need to clean around. And so over time, sometimes that will be the primary cause of new cavities, is because we've just lost a lot of gum support around the teeth. And so now there are a lot more surfaces to clean. And that can be really hard, especially as we get older and maybe a little arthritis, our dexterity isn't quite as good. And now we've got a lot more tooth that needs cleaning. And then if our diet's not just amazing, then we're going to have plaque buildup. Again, these are all things that are just very common as we get older. And so that's really the biggest one that I see. And then over time, if we lose enough gum tissue and enough bone, then we do start losing teeth over time. So hopefully we catch it early enough that we nip it in the bud and that's never an issue.
Yeah, and I've seen people age with more and more receding gums. And I look at it from outside and go, oh, aesthetically, it doesn't look nice. If it's just aesthetics, okay, you could decide you need or not. But if it's going to lead to cavities and other complications and loss of tooth, then you go, oh, well, maybe it may be worth doing some of these grafts. But the grafts look pretty invasive. Like it looks painful. And I don't know, where do they get the gums from? And then how do they put it on?
Couple of different ways they can get gum tissue back there. One of them is to take a graft from the roof of your mouth. I've actually had this done myself. It's similar to your daughter. I had a spot where maybe I was biting a little unevenly and just an aggressive toothbrusher. And so I had an area that was super sensitive because I had recession. And so I was in dental school and I had one of the periodontal residents do my graft, and she took the donor site from the roof of my mouth and then placed it where I was missing gum tissue. And that healed and did really well. But the surgical site is like a nothing. I didn't really even feel it afterwards. The roof of my mouth, the donor site, was the really weird place, because imagine like burning yourself on a really hot piece of pizza. Yeah. Where the cheese sticks for a little bit and then you have this horrible burn on the top of your mouth. That's kind of what it feels like.
That's
as that area heals.
I can relate to that. Ooh. So yeah, go ahead. So go ahead.
But then it doesn't have to be. I would say having your own donor tissue tends to be accepted by your mouth the most easily. But if that doesn't work, or if that's not available, or if that's just not the best option for whatever reason, then they do have different types of tissue. I think there's synthetic graft, or maybe porcine, where they're taking pig tissue and using it. So there are different ways to do it, different types of grafts that they can use.
How interesting. Okay, I feel better now that you, a dentist, had done this. You had receding. Only it's not a lot,
Yes.
it's in one little
Yes.
spot, but that's okay. So interesting options that we have out there, and I really want to get my daughter to actually, yeah, not have these problems because it's just, yeah, more money, more pain, and who needs that? Another common thing that I hear a lot in our community is TMJ. Well, I forgot what it stands for. And then the mandibular joint tissue issue. You have,
Mandibular joint. Yeah.
but I don't know if it's in or clicking jaws. So, what are and I'm guessing this has to do with stress, but what are some of the best ways to solve these problems for the patients that you're seeing?
This one is such a tough one because it is really common. And you're right, TMJ is usually what people say, but TMJ is just the actual anatomy. So we've all got a temporomandibular joint is what TMJ stands for. But what can happen in it, we refer to it as TMD, or temporomandibular dysfunction, is when there's pain or anatomically things aren't quite right and there's clicking and dysfunction in the area. When it's painful, man, it can really just take over your life and be miserable, like any kind of chronic pain. It can make you into a different person when you're in pain. And there is something just especially awful about pain being literally in your face.
Yeah.
When you just can't escape it. It's harder to ignore than pain in your left toe. And so these are cases that can be really hard. So we start very big picture because yes, a lot of it can be just stress and tension related. So we start big picture with the easiest things to solve, and then we get more and more complex if and when we have to, assuming that it's muscular and that it's stress and tension based. That's where we start because that is probably the most common. And it's most common with women in their childbearing years. So we're looking at how can we find the spots that are tense? How can we find the muscles that are knotted up? Sometimes it's outside of the mouth, around the jawline. Sometimes it's inside of the mouth. And we're looking for those spots. And I'm teaching patients how to actually find those little trigger points because you can find them and you can get those, just like any knotted up muscle, you can give it some love and get it to release sometimes on its own and give you a little bit of relief. So that's where we start. And I have amazing like body workers, massage therapists, chiropractors, and people that can support that if just my tips in the office aren't working. After that, then sometimes there are some appliances that can be helpful for TMJ. Not always. Some appliances actually make it worse. So we want to just try an appliance. And my favorite, if somebody is already having pain, my favorite appliance for that is called an NTI device. And it's a mouth.
And there's a guy on Instagram who is somebody was shared it with me and they were like, this is amazing. And it's some device they put on the jaw. Is that what it is?
Oh, interesting. This one is something that you actually wear in the mouth on the teeth. So it may be different. I know you'll have to send me a link when you find that
Apparently
Instagram.
he's like really big. Yeah. And he's a young guy. And I'm like, wow, I don't even think he's a dentist. He just came up with this device and people
Oh,
are
that's
raving
awesome.
about it. So I'll
Yeah.
find it
Yeah.
and send it to you. I'll get it.
Anything that can create a little bit of relief for these people who are in pain is so helpful. But sometimes it takes more than that. And sometimes there are some really complex bite issues. And sometimes there are some really complex joint dysfunctions where there's actually a little disc that sits in between the temporal bone and the bone of the mandible. And that disc can sometimes actually pop out of place. And when it pops out of place, there's tissue behind the disc that the bone will sit on. And that tissue behind the disc has a ton of like blood vessels and nerves, and that can create a lot of pain in itself. So when we get to some of these more complex issues, then then I'm bringing in the big guns because it is a complex field. And so I have dentists in the area who deal primarily with facial pain and with TMJ dysfunction. And I will refer to them because it does get really complex. And again, you're dealing with a chronic pain issue that can be really tricky. We can do prescriptions and muscle relaxers and things like that just to put a Band-Aid on it, but that's not the answer. That's just to get people to sleep for a couple of nights.
Do people eventually have to get surgeries?
Some, I would say that's pretty rare, thankfully.
Oh,
That's pretty
okay.
rare. But yeah, on occasion, especially if there's an anatomical dysfunction that can be corrected, where you can move bones back into a more ideal position or move disc or support a disc in some way, then yeah, there are some surgical options.
But most of the time, are people managing their pain or are they actually solving their problem?
Most of the time, honestly, most of the time they are managing pain and tension, like finding ways that work for them to resolve the tension time. And again, it's for somebody who the pain starts when they're 16, 17, 18 years old, then as their hormones settle and become a little more consistent, then it tends to be easier to manage. And
And
by this point, the patient is learning, okay, what makes my body more inflamed or what calms my body? And that will in turn calm their TMJ if they have a flare up. Like it kind of comes in flares. If this is somebody in their 30s or 40s when we're finding this and they are starting to have flares, then yes, we need to learn what's causing stress, what life stressors are happening, where do you need support in areas of your life, and also once your hormones dip during perimenopause and menopause, then it also tends to go away on its own unless there's something truly anatomical going on.
yeah, I guess it depends on the reasons why. And if you can't tell yet, I have TMJ, but
Really?
I'm asking all these questions. But for me, it was when I was in my 20s, my mother passed away. And I remember my jaw, I couldn't open my mouth. I was like, oh my God. It was like all day, finally, like relaxed. And then
That's terrifying too.
I know I was terrified and I was in Ukraine and nobody could help me. And
Oh
I
my
was like,
gosh.
horrible. So I do, but ever since clicking jaw, and it doesn't
Mhm.
hurt, doesn't bother me. I mean, I've had dentists say, oh, you're going to have an operation one day. And I'm just waiting. It's just there. My daughter just, like, whenever I eat, she's like, ugh, you're clicking jaw, like, stop. And I'm like, are you in perimenopause already? Because I don't even hear it. But interestingly enough, she's starting to have a clicking jaw. And I don't know if this is genetic, but I'm always wondering because it's not painful. Am I going to pay the price one day? Because you always feel like it's something you're going to wear out the cartilage. But I think some people described it as just like I don't know, a piece of your I don't know, cartilage or tendon that's just getting rubbed all the time. But yeah,
I think it's kind of like popping fingers.
it's
If you're
popping.
not having pain, then sometimes there are just body parts that just pop and click.
Okay. So don't need to do anything about that, right?
No,
Okay. Okay.
less is more.
Awesome. So now that we have all of my problems solved, let's move on to some bigger issues
Uh,
like root canals and crowns. I haven't entered that field yet, but I know that they're common and they're also controversial. So, what are the risks and are there safer alternatives? And maybe we should explain what root canals and crowns are.
are. So a root canal is when the nerve is either so inflamed that it cannot heal, or the nerve is actually dead and necrosed. And a dentist will go in and they will use teeny, teeny, tiny little tools to go into the root canal of the tooth, and they will remove the nerve of the tooth so it's no longer in pain. And in the process, that also removes the blood supply of the tooth. So within the canal of each tooth root, it's kind of like a hollow pipe in there. The nerve, blood supply, all that stuff is in within the canal. So take tiny little file, get all that soft tissue out of the canal itself. The dentist will clean and disinfect the canal as best that he or she can, and then place a whatever kind of synthetic material, like a filling type of material that he's using or she. I don't know why. Endodontists, I see more male endodontists than I do female endodontists right now. Not true in general dentistry. They're more, it's about 50-50 in general dentistry. So we've removed the nerve, we removed the blood supply. The reason that it's controversial is because we can't actually 100% say that we've disinfected the tooth. So not only does the root have one large canal that we can see visually when we take a tooth out, you can see it on an x-ray, the little hollow tube down the middle of the root. But what you can't see are all of the little microscopic accessory tubules that go out from the main canal. There's hundreds and hundreds of little accessory canals. And so even though we do as best we can to make sure that we flush the area, that we use disinfectants in the area, you can't say that you've completely cleaned out the entire root canal system within the tooth. It's impossible. It's like a sponge. It's like saying you've removed every germ from every hole in a sponge. So that's one thing, is that we can't completely disinfect it, even though we try and we do our very best. So because the blood supply is removed, the blood supply, the blood is what supplies oxygen to the area. Red blood cells are carrying oxygen. So you create essentially this dead body part in the area. So what once had blood flow, what once had oxygen, now has no blood flow, has no oxygen. And that changes the immune response to that area. And the microbiome shifts. You have microbiome even inside of the teeth and inside the jawbone. So instead of these aerobic, oxygen-loving bacteria, now you get the anaerobic, these oxygen-hating bacteria. They're kind of like the bottom feeders of the microbiome. And so some people started to notice that, interestingly, they noticed that their chronic health symptoms popped up maybe 6 months or so after they had a root canal, and noticed that was an interesting correlation. Now, again, you can't prove that it was the cause, but an interesting correlation. And then more people started noticing that, oh, when they had their root canal removed, like when they just removed the tooth altogether, that some of their chronic health symptoms started to clear up, that they started feeling better. And as so many of us know, some of these chronic illnesses, you kind of just have to peel back layers of the onion to get well. You get well kind of in like little steps at a time. And that removing a root canal was one of those steps. And so it's really interesting, like the narratives and the political aspects of it, because we'll have hardcore dentists, members of the American Dental Association and the American Endodontics Association, that say, you can't prove this at all. The correlation doesn't equal causation, and stop talking about this. Root canals are just fine. And then you have people on the other extreme, some biological dentists, some naturopaths, functional medicine doctors, who are now saying, root canals are all terrible. They're all infected, and root canals cause cancer, and all of these like scary things. And I think the right answer is neither extreme, but somewhere in the middle. And I think it's different for every patient. Again, what is the terrain of each individual patient? How healthy or how unhealthy are they at any one particular phase of their life? And how well is their body able to handle that extra tax on the immune system of having a root canal in there? Where I tend to fall with my patients is we go over what are the pros and cons, what are the pluses and the minuses, the risks and the benefits from a dental perspective. And then we talk about the risks and the benefits from a health perspective for them specifically. What do we know about root canals? What do we not know about root canals? So that patients really have the whole picture on what makes the most sense for them. So I don't take just a hard ethical line in either direction. My hard ethical line is that patients need to be making these decisions with all of the information. And then I will tell a patient, like for an example, if I've got, let's say, a 70-year-old patient who has no chronic health issues, is on no medications, who feels just fine, and has three other well-functioning root canal teeth in his mouth. And now he's left with the choice of either a root canal on another tooth or losing that tooth. Then I would say the risk is probably pretty low. I think it's probably the risk is low of doing a root canal. If you're not morally opposed to doing a root canal, I think you'll probably do just fine with another one. That's usually where I fall. And then I may have a different patient, maybe similar scenario, but 35 years old, has one autoimmune condition, has a family history of breast cancer, or maybe she's already had a breast cancer scare herself, has never had a root canal, but she's one of these like canary in the coal mine kind of people. She's just super sensitive to all things. Then my advice may be, here's all the information. My advice might be that the risk on this one actually kind of worries me. It actually kind of worries me. Yeah.
So if I understood, I think I may have lost you somewhere, that this is when you have a tooth that bothers you. It's not a cavity, it hurts, it's painful, it's kind of dying. And what you do is you drill into it and remove the nerve and the root canal, quote unquote. Is that like a piece of something you stick in there, or is it just dead in there? Like it doesn't have anything.
Yes, you basically stuff the canal with an inert material.
Oh, okay. Okay. So then that's what you're saying when you remove the root canal, that means you're removing that material that's stuffed inside. Maybe people start to get better, but then they're left with the.
No, no, when they're removing a root canal, that means they're removing the entire tooth.
Oh, okay. So they
Yeah.
remove the tooth and the canal. Their chronic conditions may alleviate, and then they have to replace it with some tooth of porcelain, or I don't
Like
know what you use.
maybe an implant. Maybe they only replace it with something removable, like a partial denture or a bridge or something like that. Yeah.
Okay. For somebody who's listening now who have root canals and they're thinking, oh, yeah, maybe I am not feeling well, maybe there is some correlation, is the recommendation to talk to your dentist about removing it?
I would say so. Yeah, absolutely. And the best way that you can see, I think we need to see, is the root canal functioning well? And can we see any signs of infection around the root canal itself? So beyond just doing like your typical 2D x-rays at the dentist, some dentists will have, and more of us are getting this machine. It's a 3D x-ray called a cone beam CT. And when you get this cone beam CT, I can actually see in 3 dimensions way more detail. And so we can see, are these root canals actually doing well? Do they look clinically intact? Or is there sign of infection that's small that maybe the patient doesn't feel, but we can see if there's either some chronic infection going on a lot of times.
So the autoimmune patient then is who you say, oh, you got to think about this. What's her alternative?
If the tooth is truly dead or dying, then I don't think it can be ignored. Like I think we need to make a decision of some kind, which is a tough decision because a lot of times our options are either do the root canal or pull the tooth. And that's a tough decision sometimes.
Why do people have dead teeth, or why they becoming a problem?
Several reasons. It could be from a large decay, a large cavity that's gotten into the nerve of the tooth. Sometimes it can be from a crack in the tooth or trauma to the tooth. If it takes a blow for some reason, we see this a lot of times with kids in sports, or somebody just falls on their face. That can cause enough trauma to the tooth that the nerve dies. Sometimes, unfortunately, sometimes it's a cavity that was just a medium-sized cavity, looked like a no big deal, but it was close enough to the nerve that just doing the dental work itself caused enough inflammation that the nerve of the tooth died. And those are really stinky situations because then it seems like it's the dentist's fault You're like, I wasn't hurting before I came in, and now I'm hurting after I got this work done. But sometimes the tooth just doesn't respond appropriately to having dental work done on it. But those are the most common reasons. Usually it's deep decay, extensive dental work, or trauma or a fracture to the tooth.
Okay, we have so little time left. And do we have time to cover crowns? Or do we save
Sure, let's
for
talk
another
about crowns. Yeah, because the crowns can be a really good way to, and I do crowns all the time on my patients. We want to be conservative where we can, but sometimes less conservative is actually the better option. And this is one of those areas. So a crown is when we remove enough material on the tooth itself. So it is invasive because I need to remove about 1.5 to 2 millimeters off the top chewing surface of the tooth and about 1 millimeter around the circumference of the tooth in order to make room for whatever the crown material is going to be, usually porcelain or zirconia. In the old days, they used a metal underneath of porcelain. We don't use those anymore. Some dentists still do, but we don't. So that's what a crown is. And the reason that there are sometimes needed and necessary is to protect the structure of the tooth. So if you have a large piece of the tooth that is missing, I would say, usually half of the part of the tooth that you can see, if half of the tooth is missing, either from a large cavity or the tooth cracked, or you bit down on peanut brittle is like the worst. Peanut brittle is not your friend, or will help pay for my kids' college. Um, that if half of the tooth is missing, then doing just a large filling is not going to protect the structural integrity of the tooth. And so the tooth that's remaining is much more prone to breaking or cracking. And the way that we keep that from happening is often by covering that tooth with a crown. And so that can give us much more longevity. Crowns typically do really well. They last hopefully for 20 years or more. And that's what the procedure is. But sometimes it is needed and necessary. And even though it is more invasive than doing a filling, sometimes that's a much longer lasting option when you're missing a bunch of tooth structure.
My brother chipped his tooth when he was biking when he was 10, but we always said he had a cap put on. Is that different than a crown?
No, a lot of times that's the same thing, usually the same thing. The cap is, I think, more of what general population uses, a cap, a crown, but all kind of same thing.
Ah, okay. Didn't know that. Okay, I still have a billion and one questions for you because I want to cover cavitations and I want to cover some amalgams and how to remove these things, these mercury fillings and toothbrushes and toothpastes and flossing, but we have to do another episode if you're okay with that.
Would love it. Yes.
Yeah,
Is
because
that too much important stuff to talk about?
we have so many cool things. I love it. Yeah. Thank you so much for agreeing to that, first of all, because I do have all these questions on my list. But let's say that you're the biological dentist and you're looking way beyond just teeth and gums and you're connecting our oral health to our whole body health. So I've got to ask, what's the biggest myth about our teeth that you wish would finally die?
Mm. Oh, that one's easy. The biggest myth is that you need fluoride to keep from getting cavities.
That's a big one.
Real myth.
Oh my
Yes.
goodness. Okay. Then we will have to cover in detail that the next episode, but why shouldn't we have fluoride? If you can answer that really quickly, and then I can let you go.
Fluoride, even though people will say that it is natural, which is true, fluoride is naturally occurring, but the form that we have put in our water supply is definitely not natural. And fluoride is not an essential nutrient. It's not an essential nutrient. I have an entire practice full of patients who have healthy teeth without fluoride.
But
And
doesn't
I will
it
tell you, like,
protect our teeth? That's the whole game. It protects the enamel.
it's a tool. It's an ingredient that we use as a tool that can prevent cavities, but we have other tools that have a better risk profile than we now know that fluoride has. And so I would much prefer using other tools besides fluoride.
Okay. I think we have to leave everyone on a cliffhanger there because I'm going to ask you what that is. So we'll take a deep dive into fluoride and toothpaste and all these alternatives in our next episode. So I want to thank everyone who's gotten to the end of the show. I'm sorry to leave you on a cliffhanger, but we do have to wrap it up here. But thank you for being with us. We truly appreciate you. We're glad that you were just as interested in this topic as we are. And thank you, Dr. Toni, for your time. And I look forward to seeing you again next time.
Thank you so much. I look forward to it.